Bone bruise pattern and mechanism of anterior cruciate ligament injury in professional football players, a correlation between MRI and video analysis findings by the Aspetar group in collaboration with the Rizzoli group in Italy and the Isokinetic group in Italy as well. We have, as a faculty, no disclosure to the content of this poster. The background is that there is a presence of bone bruises, especially in the lateral compartment of the knee, as a common finding in the context of a knee anterior cruciate ligament injury. Different patterns, however, have been described, and a precise correlation with the mechanism of ACL injury has not been determined so far. The aim of this work is to look for potential characteristics of bone bruise patterns in both tibia and femur on MRI imaging, specifically at the exact moment of the ACL injury occurring, with and without direct contact, and while the football player is in single leg loading. Also while pivoting, trying to perform a sudden change of direction, and landing from kicking and tackling. As you can see here, these are the moments of ACL injury during pivoting and change of direction, during direct contact, and during landing from kicking and tackling. The methods are that ACL injury data was collected over the last 5 years on official matches only, and a combined detailed video was available, and all was extracted from the Qatar Stars First League football. We analyzed the exact timing of ACL injury and retrieved the pre-operative MRI details and the intraoperative operation details, all done by single surgeon and single institute. Knee magnetic resonance, STIR, and 2T MRI was obtained within 7 days from the injury. Bone bruise and meniscal and cartilage lesions were analyzed on MRI, while a video analysis of mechanisms of ACL injury and injury dynamics were assessed from the videos. The results are variables on the trunk, hip, knee, foot strike, foot position, and alignment dynamics. The most common pattern of bone bruise, present in 53% of cases, was a femoral bone bruise more than 5 mm in the central portion of the lateral femoral conda, and as well in the posterior portion of the lateral tibial plateau. In all these cases, the injury occurred with single leg loading during a pivoting maneuver while changing direction during pressing, dribbling, goalkeeping, or in response of being tackled on the upper body. All these injuries occurred without direct contact, high horizontal speed, and with abducted hip. Other patterns of bone bruise were 20% in the tibia, 20% no bone bruise, and 7% had a tibia and femur bone bruise less than 5 mm. In these cases, injury occurred due to direct contact, recovery balance after kicking or jumping, and while tackling. In conclusion, a characteristic and well-defined bone bruise pattern with bone bruises in both tibia and femur were identified in ACL injuries without direct contact and while football players had a single leg loading while pivoting, trying to perform a sudden change of direction. These are the references. Thank you.